Yes, and we're back here in What's Up, of course, together with me is my co-host, no other than the birthday boy, Dr. Ray Ranlao.
Yes, and welcome to
Yes.
our second segment. Alam mo, Dr. Seneca, napakaganda ng topic natin ngayon.
Oo nga.
Very controversial one.
Alam mo, parang
in the field of medicine.
na-regenerate ako
Oo.
dito sa magiging topic natin because this is
Yes.
part of what we call regenerative medicine. No?
Yes, oo.
We have to be rejuvenated, regenerated.
Ito ibang klaseng type
Oo.
of treatment. Hindi
Exactly.
pwedeng pagpapaganda, pero more on ito systemic.
Sabi
na
nga nila,
ginagamot
pwedeng humaba ang buhay ng tao up to
Yes,
100
oo.
years.
Kaya nga,
And let's see, no?
very
Talagang totoo yan.
controversial, yes.
Oo. Sige, Dr. Lau.
So our guest is a second timer here at What's Up Doc.
Yes.
He is a stem cell specialist, no other than Dr. Christian Mancao. Good afternoon, Dr. Mancao.
Magandang
Good afternoon, John. Good
Hapon
afternoon,
po.
Rhea.
Yes.
Fran.
Opo. Oh, at stem cells is a very controversial topic, no? All over the world.
Yes.
You know, there's a lot of people who believe and there's a lot of people who don't believe.
Medyo hati pa ang
Hati pa yung,
population natin.
especially the
Oo.
doctors.
So,
no?
for our televiewers, Dr. Mancao, explain po muna natin, ano ba talaga, what is stem cell?
Stem cell, number one, is natural healing.
Natural healing.
Natural healing. It's your body healing itself.
Yeah, what
Okay.
kind of cells ba yan? Kasi stem cells, yeah, it's a healing. But ano ba tong cells na to? Where does it came from?
That's
you
a very good question.
Yeah.
We have more than 220 differentiated cells sa katawan natin.
220.
Nerve cells, muscle cells, all those cells. But stem cells are blank cells that can become any of the 220 cells. Ang trabaho naman talaga ng stem cell is to maintain our body.
Okay. So we have stem cells.
Everybody
body.
has.
Okay.
And there are also plant stem cells.
Plant stem cells. Okay. Kasi marami ang nagkiklaim na stem cells, no? Mamaya di-discuss natin yung mga topical stem cells na yan.
So, pag kunyari, sir, sabi mo kanina, it's general healing. So, if we have problem or inflammation inside our body, does our body
Activate.
produces stem cells agad?
Well, our body tries to do that, but at the critical age of 40,
Okay.
may problema tayo. Di ba, life begins
At 40.
to deteriorate at 40.
Okay.
Nakalimutan natin yung to deteriorate.
Wala ka pang 40, no?
Malayo
Parang
pa
pala tayo, medyo...
Okay, so magandang point yan,
okay pa.
Dr. Mancao, no? Kasi
Oo.
lagi natin sinasabi, life begins at 40. Yun lang eh.
No. Degenerative diseases happen at 40.
40.
At
So,
40,
life begins to deteriorate at age
yeah,
40.
Age
but
40.
they just remove the
The
to deteriorate.
Deteriorate.
Okay.
Okay, that's nice. So, ano po ba yung pinaka-common source ng stem cells? Saan ba talaga kinukuha to sa parte ng katawan natin? Ano yung pinakamadaming stem cells
Yes.
sa part of our body?
Ang pinakamaraming stem cell rests nasa hypogastric area, sa puson.
Okay.
Sa puso.
And Zook and Associates in the year 2000, they found out na nandun pala yung pinakamarami galing sa liposuction.
Oh, that's the fats.
That's why if you hear of products for the face, no? Whether they are serums or they claim
Creams.
stem cell.
Yes.
Actually, they're stem cell products. They are derivatives of stem cell, but not stem cell itself.
Saan galing po yun, sir? Yung mga nasa lotion,
Nasa
creams,
creams o yung mga
serums?
topicals.
Supposed to be, it's allogeneic. It's from other species or other humans.
Okay.
Other
You
humans.
mean from human stem cells was placed in a cream?
Yeah, there are
Or
products,
like a plant stem
there are
cells?
products like that. There are also plant stem cells,
Yeah.
which is very, very popular.
Yeah, okay. Are these effective as like the human stem cells?
The
plant
growth
stem
factor component, yung growth factor component, is the one that makes it effective.
Okay.
But we're not talking about stem cell kasi walang stem cell doon eh. There's no stem cell there.
How about,
Okay.
sir, if a patient wants to have a stem cell and the problem is wala siyang kahit anong fats sa tummy, can you,
Can you
harvest
from
different part of the
I
body?
find that very strange because the last fat that I know of that will really disappear is your hypogastric fat.
Oh, okay.
Ano,
Yeah.
sir, yung
That's-
mga
Maubos na yung lahat ng fat mo,
So,
meron
pero
pang laman.
Any
doon.
other source?
Is it possible na
You can
kumuha sa
get,
iba?
in all organs of the body, there are stem
Pero
cells.
not as rich.
Yeah, like dental stem cells, you can get it from the pulp.
Yeah. Okay. Oh, okay. Now, ano ba yung mga indications ng stem cells? Bakit ba na-discover itong stem cell? Is this really for what? Is this for rejuvenating? Is it for
Terminal
healing?
diseases,
Terminal diseases?
Pain management.
Oo.
My fascination actually with stem cell therapy has been on yung cases na medical practice has no answer. Or with our back is against the wall like in cases of cardiomyopathy.
Okay.
Wala na mangyari. Multiple sclerosis, Parkinson's disease, and the other
Mga
degenerative
difficult
problems.
cases. Difficult cases.
Yeah, when your back is against the wall and the pharmaceutical armamentum is more dangerous to the patient because of the side effects,
Yes, yes.
then it is better to do natural healing.
Oh, so yun yung pinaka-indication pala.
Correct.
Oo.
Then we have a live texter from cell phone number 4721 calling
Yes.
from Mrs. Veneranda Martinez of Baybay City. Saan yung Baybay?
Leyte.
Leyte,
Yun.
okay.
Hello, Doc. At my age 58, anong gagawin para hindi masyado magkulubot ang aking balat? Ang concern
Ayan.
naman
Si B
ni
siguro,
Mrs. Veneranda
if,
is
let's say if we,
I believe sila
is stem cell effective
For
for like
rejuvenation.
wrinkling or
Of course,
rejuvenation?
no question about that. For
Yes.
rejuvenation, stem cells. Stem cells are the ones that maintain you. They're the ones that maintain you. But at 40, instead of 95 million active stem cells continuously repairing your body, it becomes, if you are about 60 years old, less than 15 million active stem cells. That's why if you have a scratch at 15 years old, in 3 days, wala na yung scratch.
Okay.
But at 60 years old, if you have a scratch, at 2 weeks, 3 weeks, the scratch is still there.
So for aesthetic purposes, Dr. Mangkaw, tanong ni ni Ma'am Martinez, pwede po siyang gamitin?
Pwede.
Can we inject the stem cell, part of the stem cell, kumuha tayo ng kaunti and directly inject it in the face?
The face like in the skin or scalp?
Yeah, you can easily do that. But remember, you cannot. Most of the stem cell procedures come with PRP also, platelet-rich
Yes,
plasma, which is also a mini stem cell procedure.
Okay.
Ano ba talagang indication nito, ang stem cells for the for the body
Magandang
system?
question yun because before, in 2012, when I started to delve into the practice, it was only 150 indications. 150. but
150.
Pero marami na rin
Dami
sir.
yun, ha?
Oo.
Oo.
ngayon, it's more than 500 already.
Oh, wow.
500 indications.
Keeps
Triple,
on
ah?
increasing and
More than
increasing.
Pero sa practice niyo, sir, sabi niyo nga, when your back against the wall, ano po, sir, yung nakita niyong diseases na pag na-stem cell, sir, na incurable sa mga medicine, mas nagre-respond to stem cell treatment?
Well, most of the diseases, but I'm more fascinated with cardiomyopathies.
Cardiomyopathy.
Cardiomyopathy.
Do you know emphasis niyo?
Yeah, kasi sa cardiomyopathy, mga doctors, they tell them, wala na kami magagawa doon. But when you, even if you PRP them IV, they improve dramatically. So what's the
Even
big
with the
idea?
PRP lang, sir?
Even with the PRP, that's why mas maganda if you would try to venture into the PRP,
Okay.
doing it IV.
Totally ba, sir, na re-reverse or medyo na humahaba
Mag-improve.
yung...
Mag-improve ka agad.
Mag-improve
Mag-improve
ka
ka
agad.
agad.
How do you infuse stem cells through cardiomyopathy? Is it
IV.
directly to the heart or IV?
No, you do IV, but you do it very, very slow. Don't give it as fast bolus because it will be sequestered in the lungs.
Correct.
So you try to do it
How
slow.
long? How slow is that?
1 hour at least.
1 hour.
Paano ba, sir, magta-travel ang stem cell to the part of the body where is needed? Yes.
That is a very good question because that has been the riddle that many people wanted to
parang
answer.
ano yan parang let's say how do the stem cells know where is the
For example, at age 60, ang
Yeah.
dami mo ng comorbidities,
Oh,
ang
let's
dami
say you
mo ng
have
ailing.
diabetes, you have cardiomyopathy,
Okay.
you have a lot of diseases. And how does the stem cells go to this particular part of our body and say, hey, come here, and please heal me, something like that.
All the cells in the body, they communicate with each other.
Okay.
I believe primarily to radio frequencies.
Yeah.
But the advantage of stem cell, it's not like white blood cells or leukocytes. Leukocytes have to squeeze themselves in the small holes of the capillaries to go out through diapedesis, di ba?
Diapedesis.
Dahan talaga, they have to squeeze themselves. But with stem cell, it's different. They call it AVE, active vascular expulsion.
Oh,
The
okay.
capillary wall will open and the cell does not change, the stem cell doesn't change shape. It goes
Goes
through.
out.
Just like saying open sesame.
Oh, so kumbaga sa kwan, pag nakita ng stem cell, pasok kayo, VIP to.
Oo, kasi yun
dito
naman,
kayo, dito kayo.
alam naman na kilala na trabaho nila, taga-repair.
Oo nga, exactly.
So, sige,
to. Kasi isa pa sa mga questions dito ng mga ating audience is that stem cells become very, very controversial. I mean, does it already accepted by the medical in the medical field? And how about the Department of Health? What do they say about stem cell therapy?
Stem cell therapy is limited primarily in big hospitals. But remember, in the practice of medicine, our goal is to prevent and alleviate human suffering. Now, you cannot let your father die miserably when there are other methods which are available, which are
Correct.
least invasive or
Exactly.
non-invasive.
And I really appreciate that.
And if you just say that, no, hindi pwede yun, what kind of a doctor are you? What did you swear on? Was it a Hippocratic oath or a hypocrite's code that you swore upon? So para sa akin, where it is needed, the whole world is actually doing it.
Yeah.
And why should you stop
exactly,
it? Mm.
Exactly.
Sir, in your practice, what are the complications? Is there any,
Any
complications during a
that
stem
you
cell treatment?
experience?
Generally, no. I have not seen in my practice. I have not seen because of we follow strict aseptic procedures. I use Stargates to sterilize the air of the where I practice. So at least it is minimum, and I use a closed method.
Okay.
It's not an
technique,
open
yes.
method.
That's true. Now, how about, sir, because there was a controversy from death because of stem cells, and also stem cells coming from the sheep.
Yes.
You know,
that's a
Sa
good
ibang
question.
bansa to, no?
Sa ibang bansa.
Yes.
Ano, what can you comment on that?
Your father and mother cannot give you stem cells.
Okay.
You have to do HLA typing,
Yes.
and you have to do DNA matching, and we are species specific, meaning to say, if you cohabit with the sheep will not have a baby human being.
Yes.
Yeah.
The body will reject that right away. We're talking about stem cells, huh?
Yeah.
What I understand from the methodology in Germany, that is more growth factors,
Growth factor.
which stimulate organs to respond.
So it's not a stem cell.
Paano mag-stem cell? John, use your head. If the stem cell of the sheep will grow inside you and it is a male sheep,
Uh-huh.
then slowly something will grow there. You understand? And your tail will
Baka
start
mamaya
to
pagsalita mo,
waggle.
meh, gano'n ka na rin.
Ganon talaga. I mean, alam naman natin in science, stem cells. These are cells which they know na that is what they are. Sheep lang talaga.
Yeah. That means that you mean that all stem cells are only for same person.
It's
Autologous.
best, oh.
Autologous. Yeah.
We encourage autologous, although allogeneic or from other people,
Yes.
they are doing that, especially in bone marrow transplants or those
Okay.
with bone
true.
cancers or leukemias. They're doing that.
Talking about, sir, bone marrow stem cells, what is more effective? The bone marrow or
Yeah.
sa adipose?
Or sa adipose.
Everybody
fats.
knows that fats is always better.
No.
Now, let's go to the science of it, okay?
Plus, it's easier to harvest.
Of course. And the
Yeah.
patient is happy after doing it.
Yeah.
Wala pang fibromyalgia.
That's
You know, when you puncture the bone, even hit the periosteum, it's very painful. And if you should know how to anesthetize correctly.
So ito, two birds in one stone eh. Kasi you mentioned, Dr. Mancao, you need a liposuction. And liposuction, papayat ka na, babata ka, pahahaba pa yung buhay mo.
And how much fats do you need? I mean, to extract. Kailan ba? Lahat yun. Tapos gawin natin yung stem cell lahat. Oo,
You just
para mas
need-
marami.
You need 200 cc. Especially we do banking, di ba?
Okay.
So we remove 400 or 600 cc if you do banking.
Okay.
Pero pwede rin naman, Dr. Mancao, Doktor, sagarin mo na, kortehan mo na ako dito.
That happens usually. That's why preoperatively, we don't do intraoperative change in operative schedules.
Correct.
We have to decide that before the surgery.
Yes.
Kasi pangit yung you add on a surgery inside the OR.
Yes. And alam mo, later on, we will be combining it with the Mrs. International World, who is also a doctor. So happens he is also a dermatologist. And let's see about combination of stem cells and dermatology together with our guest, who is the Miss International World, who will be with us. And we'll be right back when What's Up Doc returns.
Natural look nose lift, cleavage by breast augmentation, curves by liposuction, non-surgical treatment of varicose veins. Janssen Cosmetic Surgery by Dr. John Seneca.